I'm Dr. Bill Adams, and you're watching the Plastic Surgery Channel.
Welcome to Plastic Surgery News. I'm your host, Deanne Moore. Thank you for joining us today. In this week's report, we'll find out why some eyelid surgeries are creating more problems than they solve and leaving customers with the need for expensive revisions. We'll tell you how a pleasant afternoon spent in the company of man's best friend may end up with a visit to the plastic surgeon, and learn about a new kind of filler that promises a more natural look when smoothing away wrinkles on the face. But first, if real life teaches us anything, it's that you get what you pay for. Nowhere is that bit of common sense more evident than in the world of plastic surgery. A type of cheap facelift procedure called a thread lift has recently been singled out as an example of a waste of time and money. The thread lift procedure, which makes use of implanted metal barbed threads, may be less costly than standard facelift procedures, but it doesn't work well and it cannot be recommended. That's according to a team of state researchers and independent assessors in New York in a study published in a current issue of the Archives of Facial Plastic Surgery. The study, which admittedly only surveyed 33 patients, compared the results of 3 procedures: thread lifts alone, non-surgical facelift procedures, including fat injections and chemical peels, and thread lift surgery plus non-surgical procedures. 1 month into the survey, patients from all 3 groups showed noticeable improvement. But when the researchers came back to examine the patient's face a second time, 12 to 31 months later, only the patients who had undergone the non-surgical treatments with or without thread lifts showed lasting improvement. The patients who underwent the thread lift operation alone showed no long-lasting improvement. The authors concluded that any improvement in skin tightness in thread lift patients was caused not by the barbed threads, but the plain old swelling. As the swelling decreased, so did the tightness, leaving the patient with a face full of fish hooks, a lighter wallet, and nothing to show for it. The researchers concluded that given these findings, as well as the risk of adverse events and patient discomfort, use of the procedure for facial rejuvenation simply could not be justified. Now for a quick quiz. What's the most popular type of cosmetic surgery performed in Asia? Breast augmentation? Nope. Tummy tuck? No. Facelift? No. The answer is blepharoplasty, an eyelid surgery, and the patients driving the trend are actually young girls, often of school age, who are opting to have a crease surgically added into the eyelids to minimize the typical ethnic look of Asian eyes. Now, a University of Hawaii professor has published a report warning that failure by cosmetic surgeons to take ethnic differences in eyelid size into account can cause undesirable surgical outcomes. Around the world, wide, sparkling eyes are considered ideal by millions of women. Yet while people's actual eyeballs are more or less the same size across the globe, their eyelids are not. According to a report published by the Asian Journal of Ophthalmology, the typical Asian eyelid is 7.49 millimeters, while the eyelid for a typical European descendant measures 10 millimeters. This extra length creates a double crease in the upper eyelid and allows the lid to fold over itself when opened, revealing more of the eye and producing the wide-eyed look typical of Caucasians. The shorter eyelids of people in the Far East lack this crease, making the eyes look comparatively smaller. The University of Hawaii's Dr. Jorge Camara says that more and more Asian patients are being subjected to eyelid surgery based on typical European eyelid measurements, which can result in their new eyelid creases placed too high, giving the patient a look of permanent surprise. Corrective surgery is necessary to repair such a damage. Of course, many Asians have no desire to modify their ethnic look, and members of certain ethnic Asian advocacy groups argue against cosmetic blepharoplasty on principle. Nevertheless, the demand for eyelid surgery shows no signs of letting up, and some surgeons recommend that people considering cosmetic eyelid surgery use tape or a fine marker to show their plastic surgeon exactly where they want the crease on their eyelid to be. Coming up, the truth about TV star Heather Locklear's plastic surgery. What has she had done? We'll give you the full story. And if you want to smooth away those wrinkles, we'll tell you about new advances being made in engineering soft tissue fillers. Stay tuned to find out how. But first, a quick break. We'll be right back.
You've invested a lot of time planning your plastic surgery procedure. You don't want to leave anything to chance. Now, there's an easy way to have peace of mind about your surgery. CosmetiSure. Every surgery has some risk of complication, but most health insurance policies won't cover complications arising from elective surgery. CosmetiSure is an affordable, short-term coverage designed to protect you from the financial impact of possible complications. CosmetiSure is only available through participating physicians. Before your surgery, ask your doctor about coverage with CosmetiSure so you can rest assured.